This is part 2 of the aging client. In this lesson, we will discuss the changes in bodily systems as the older adult ages. As you will understand, as an individual ages, there are changes that occur in the cardiovascular system, pulmonary system, the renal system, the genitourinary system, the hematopoietic system, the gastrointestinal system, in the hepatic, the central nervous system, the immune system, and the integumentary and musculoskeletal system. We are going to discuss these systems in a little more detail. Myocardial structures and function have increased collagen content, making it less compliant. The result is increased in myocardial oxygen consumption. The heart compensates with increased cardiovascular blood flow up to a point. It results in hypertrophy of the left ventricle. There is also an increase in pulmonary artery pressure. The R wave and S wave amplitude decreases, but the QT duration increases. There is an increase in dysrhythmias, with PVC being the most common. No intervention is usually recommended, but most are asymptomatic. Murmurs are the most common. Some cardiovascular diseases include hypertension, coronary heart disease such as an MI or angina, CHF, and/or stroke. With the left ventricular function, there's an associated with decline in exercise performance. Thickening to the left ventricle wall along with stiffening of the aortic and mitral valves. The peripheral vascular function is reflected in the gradual rise in the systolic blood pressure. The intimal layer thickens. Arteriosclerotic and atherosclerotic process cause arteries to be less densible. Now, in the pulmonary system, there is a weakening support of the upper and lower cartilage causing obstructive changes. The chest wall and vertebrae undergo osteoporosis. The strength of respiratory muscles gradually decrease. There is a decrease in lung recoil. Arterial oxygen tension decreases, which puts them at a high risk for pneumonia, which is the leading cause of death among the elderly. Causes of pneumonia are either bacterial, viral, or aspiration. Okay, so now we're going to discuss the renal system, the genitourinary problems, the hematopoietic system, the reproductive system, and the endocrine system. In the renal system, there is a decrease in number and size of the nephrons due to the lack of circulatory support. The glomerular filtration rate decreases with advancing age. This predisposes the elderly patient to metabolic acidosis, volume depletion, and hyperchloremia. Micturition changes and incontinence may develop, which leads us to urinary problems. They may have many different types of incontinence. They can experience bladder cancer. Females may experience vaginitis, breast cancer, cervical cancer for females, benign prostate hyperplasia for males, prostate cancer for males, or erectile dysfunction for males. In the hematopoietic system, the patient may experience hematopoiesis. The blood cells change. One example is a decrease in production. They may experience anemia. In the reproductive system, there is a decrease in hormones and changes in sexual function. In the endocrine system, there are changes in hormone levels such as the thyroid gland becomes hypoactive, the ACTH and sex hormones change. The adrenal function decreases. They may run into issues with insulin metabolism, and they may also have a decrease in glucose metabolism, which could lead to a development of diabetes mellitus. The 3 Ps may not be present. Okay, so we're going to discuss a little bit about the immune system. They're more susceptible to infections, and the cell-mediated immunity declines and T cell functions decrease. In the integumentary and musculoskeletal system, there's a decreased subcutaneous tissue layers and increased capillary fragility, and its common problems are like skin cancers, herpes zosters, or pressure ulcers. Then there's also a decrease in lean body mass, which puts on a more risk with temperature extremes and fat distribution. There could be a compression of the spinal column, muscle rigidity, and or osteoporosis, osteoarthritis, and there's a change in height. With the gastrointestinal, they have a process of decrease in swallowing, motility, and absorption, and they become very altered. GERD is usually common, and then there's thinning of the smooth muscle within the gastric mucosa. The mucin secretion from the mucosa cells decrease, causing more risk of acid injury such as peptic ulcer. In the hepatic system, there might be a hepatocyte number and liver weight decrease, and then the total liver blood flow decreases by 50%. And then that causes the first pass clearance of drugs is then reduced, so there's more risk of toxicity with medications. In the central nervous, the performance as time test declines slowly. Brain decreases approximately 20% in size between the ages of 25 to 95. There is synaptogenesis that still occurs, and there may be plaque formation. Okay, so let's continue with some different types of systems that can cause common problems, and then some approaches. The one common problem is visual diseases such as cataracts, glaucoma, diabetic retinopathy, and macular degeneration. And then there's some pathological processes that are associated with hearing loss such as presbycusis, tinnitus, noise pollution, and ototoxicity. And then there could be some pathological changes in speech that could include dysarthria, aphasia, or verbal apraxia. If any patients experience these common problems, you want to approach them by gently calling out to the individual when you enter a room and identify yourself. You want to minimize distractions in the environment, explain every procedure that you're doing, don't move frequently, especially don't move frequently used objects that are close nearby them, and because that can disrupt their environment. And then you want to alert the person when you will be touching them. This concludes part 2 of the lesson, The Aging Client. If you have any questions related to this lesson content, contact the instructor.